My name is Emily Roster and this is my presentation on principles of safe and effective training. Components of fitness. Strength. This is the ability to work against resistance. There are three types of strength: explosive, dynamic and static. Aerobic endurance. This is the ability to exercise continuously for an extended amount of time. For example, a marathon runner would need good aerobic endurance. Muscular endurance. This is the ability to complete a number of contractions against a certain weight. Flexibility, the capacity of the joints to move in a full range of motion. An example of this is a trampolinist. Body composition. This is the distribution of muscle in the body compared to fat levels. Adaptations of training. Hypertrophy is the increased volume of tissue or organ produced by enlargement of existing cells. Stroke volume is the amount of blood pumped out per beat. When training, it will increase. Resting heart rate is the number of times it beats per minute when at rest. When exercising, your heart will increase. By training aerobically, this improves and makes it stronger and will decrease the heart rate. The lower the heart rate is, the better it is. Principles of training. Specificity. This means the type of training is specific to your sport you are competing. Training should be aimed at increasing training on parts of the body needed for your sport. Progression. This means the program of training should gradually increase in difficulty. Overload. Training can only be improved by training more than usual, meaning the need to work increases. This is not a negative thing, it is a positive thing to do. Reversibility. If any adaptation in training occurs, this could lead to a decrease in fitness levels. For example, an injury could lead to reversibility. Tedium. This is also known as training becoming boring if it is the same every time you train. The FIT principle. Frequency. This is how often you train. Intensity is how hard you train. Time, how long you train for. And type is the method of training you do. This comes in part of the overload section of the principle of training. PARQ. This stands for Physical Activity Readiness Questionnaire, which is taken by the instructors to reduce any risk of injury and also to be able to make sure they are able to make training sessions specific for the person they are with. Risk assessments. This is carried out to ensure that safety of participants. The setting up of equipment should be checked and make sure it is all safe. Clothing should be correctly worn, making sure all jewellery is removed as an example. Also making sure the area is slip and trip free. All of this is making sure the risk of injury is reduced and make sure the area is safe to use. Contradicting factors of why you would not be able to take part in sport. There are lots of reasons why people are unable to take part in sport, as you can see on my presentation. In physical activity, there's just a couple of examples. Firstly, for physical or mental disabilities, this could reduce the sports that are able to take part in. Not as many sports may be offered. Secondly, health in both short and long-term injury. This could have an effect. For example, someone who has asthma would find activities like aerobic endurance hard. This would be especially difficult.